It's a very complicated subject. There's lots of research on the topic, but I think really it's important to think about three big things. And the first of those is how trauma affects cognitive development and the development of the structures of the brain. So in the most basic terms, when children are experiencing trauma, there is a release of stress hormones for all of us. When anyone's experiencing any kind of trauma or fear, we have that fight or flight response. When children are having repeated traumatic events, there is an overabundance of that stress hormone in the brain, and we know that that causes actual damage to the development of the structures of the brain. What that also does is creates this sort of always-on state of alert where there's an overabundance of the cortisol, that's the hormone in the brain, and children are always in that hyper-vigilant state to protect themselves. What that does as far as brain development is that sort of creates a situation where the other neural pathways are not able to develop as well as they should or in a timely manner during those critical periods. And so the parts of our brain that regulate decision-making, emotional regulation, judgment, all that higher order thinking is less developed when kids are experiencing repeated traumatic events. What that means for behavior is that we have actual cognitive delays for kids with a trauma history. They can have lower IQ, they can have problems with language development, they can have problems with judgment and decision making. And so in terms of behavior, if you think about how that kind of disrupted brain development impacts behavior, so much of the way we interact with the world is through language. When we're giving instructions to kids, we often use a lot more words than we should. We also expect that kids can make good choices, and so when we give choices, we think that they understand what those choices are. But if you have cognitive impairment, if you're having difficulty understanding language, you're going to have difficulty understanding what you're supposed to be doing in those situations. And the typical strategies that we might use with kids who don't have that kind of impairment are not going to be as effective. So that's one big area that it affects behavior. The second thing you really need to think about is the issue of attachment. And again, we could have an entire class on attachment, but the basic, most simple level, we know that a secure attachment is the foundation of all further development, that we need to have that secure attachment during those early years. Children who have been traumatized, particularly from their primary caregiver, have really disorganized attachment because the person from whom they're going to go to feel safe, to learn trust, to learn that the world is a predictable and loving place, is also the person that is perpetrating this scary and traumatic event on them. And that is incredibly confusing. In order to understand the world, it doesn't make a lot of sense. And so these children don't know how to trust the world around them. They feel like they don't know how to get their needs met. And so that foundation for future relationships is very much impaired. So again, if you think about so much of what we have to do in the world to be successful is to interact with others, to read social cues, to understand what the interaction is between us and other people. If you have that disorganized attachment as a foundation of understanding the world, you're going to have a lot of difficulty with that. So many behaviors that we see from children with a trauma history are a result of just not having that secure attachment. And then the third thing that's very important, especially when you have a child in your home who has a trauma history, is understanding trauma triggers. And what that means is that there are going to be things that remind the child of the trauma, but they might not be readily apparent to everyone around them. So if you think about your own memories, things that trigger memories, smells, sights, sounds, all those things can immediately take you back to a positive moment in your childhood. With children who have a traumatic history where that's been the majority of their experience, those exact same triggers take them back to this very scary place. But they may not be evident to us. So it might seem like a normal transition from going to bedtime, but something about that event, the lighting, the location, triggers a traumatic memory, and the child's going to react as if that's happening at that time. Those reactions are behaviors that children developed in order to stay safe, and so they were very adaptive behaviors. However, we might see them as bad behaviors or negative behaviors. So it's really important to understand that Those reactions are important. They help the child survive. They help the child get through a very difficult experience. And it's going to take a while to unravel that. So it's important to try to understand as much as possible of the child's history so that we can start to look at these trauma triggers and help them move past them.